Whoo! 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 Hi guys! Back at it again with another video demonstration. And this time, this is actually a more invasive procedure that I will be doing. This is actually a chest tube thoracostomy or chest tube insertion. So if you want to know how to do this procedure, just keep watching until the end of this video. Okay, so what are we waiting for? Let's go. Wait. So before doing the procedure, there are actually several things that you should take note of. These include observing sterility by washing your hands first, introducing yourself first to the patient, and you also obtain consent from the patient. You also prepare the materials you need, do proper drapings, and of course, prepare the anesthesia for the procedure. Okay? So if you're ready, let's start the procedure. Let's go! Here are the materials needed. Gauze, plaster, suture, chest tube or chest tube alternatives such as NGT, local anesthesia, blade holder with scalpel blade, Kelly clamps, straight and curved, pickup forceps, surgical scissors, and needle holder. Model specimen, povidone iodine, sterile gown or drapes and towel clips, plastic bottle for drainage. Before doing the skin prep, have the patient assume a semi-upright position with the arm placed above the head. Next, prep the skin over a wide area of the chest wall with povidone iodine. Do this in outward concentric circles using the sternum, subcostal area, posterior axillary line, and clavicles as landmarks. Next, drape the area with 4 towels. Place first towel to the side nearest the surgeon, followed by cephalad and caudal position. Lastly, a towel opposite the surgeon should also be placed laterally. Secure with towel clips. In this video, I am using clothespins as alternatives. Locate site of insertion through the angle of Louis, which corresponds to the second rib, localizing the intercostal spaces. Slide fingers down until you reach the 4th or 5th intercostal spaces at the anterior axillary line. On this area, infiltrate the skin with local anesthetic and block the intercostal nerve branches. Remember, do not also forget to infiltrate the pleura. Make a 2.5 to 3 cm long skin incision well into the subcutaneous tissue. Insert a curved Mayo scissors or curved Kelly clamp and cut or separate the tissues so as to create a tunnel or tract in the direction in which the tube is to be inserted. This tract should be directed posteriorly, cephalad, and medially so that the tube lies posteriorly in the paravertebral gutter. Continue developing this tract all the way into the pleura. Remove the scissors or the clamp and explore the tract with a gloved finger from time to time to make sure the tract is going in the right direction. After the pleural cavity has been entered, insert the gloved finger to explore for adherent lung and then further enlarge the opening in the pleura by inserting a large Kelly clamp and spreading it. Grasp the tip of the tube with a long Kelly clamp so that the long axis of the clamp is almost parallel to the long axis of the tube. If hemothorax is suspected, it is also advisable to clamp the very distal end of the tube to avoid making a mess. You can now insert the tube into the chest using the large Kelly clamp as a guide, either apically or basally. Apical chest tubes are for air drainage, while basal chest tubes are for fluid drainage. Next, suture the tube to the skin using a silk 0. You can then tie the suture in place by using a square knot and a tight knot. It is advisable to cut the thread with the needle before tying the knot. And then, wrap both ends in opposite directions around the tube to make a series of X's. Push the suture down to secure them to skin stitch. Connect the tube to the underwater seal chest drainage system. Care should be taken to do this step properly, as this may cause pneumothorax if tube is disconnected from the underwater seal. In this video, I used a plastic container as an alternative. Place a Vaselinized gauze dressing around the tube. Next, cover the tube using two 4x4 gauze with a slit in the center and place them 90 degrees against each other to prevent them from sliding up the tube. Using a plaster, tape them into place. Lastly, do not forget to dispose contaminated materials into their respective receptacle. Obtain a post-tube insertion chest X-ray to check the position of the tube. Again, thank you for watching.